my pleasure today to receive this caravan, and as Uasin Gishu County, we are so grateful to the Bank of Africa for supporting us to make awareness.
A medical condition, not a condition related to witchcraft or something you did not do right to your ancestors or something you have done wrong to your maker. So we want to make people realize this is a problem that arises from a disorder in the brain, right? Just like malaria would happen in the blood, just like cancer happens in blood tissues, epilepsy is a medical condition. We are happy that the county government of Uasin Gishu is assisting us and has welcomed us to Uasin Gishu County, which is our third port of call after starting with the major cities of Nairobi, Kisumu and Mombasa, and we'll be extending our campaign hopefully to all the 47 counties. Our campaign is an awareness campaign, but it's also going hand in hand with a training campaign for the medical workers, so that we want, once patients are available and coming to doctors in the hospitals, the doctors will be prepared to receive them and manage them appropriately, because we believe part of the awareness is what we refer to as an epilepsy ambassador. And an epilepsy ambassador, the best you can have is a well-treated, well-managed person with epilepsy. So we appreciate the help we are getting from the government, central government, county government, and of course we appreciate the big boost you've been given of Africa. The bank who has bankrolled us into this campaign, and we do truly appreciate, because it takes a bit of money, it takes a bit of a goodwill on their part to see the beauty of this and the value of this in getting those innocent epilepsy sufferers who are sometimes, as you may have read in newspapers, chained in houses because their parents or their relatives are too ashamed to bring them out into the open. The bad thing about that is they are chained for something.
Our social responsibility in our community. And one of the pillars, we have 4 pillars that we look at when it comes to social responsibility, but health is one of the main areas that we look at. We are involved in education, sports, culture, and health. Now, mental illness, and we looked at epilepsy, especially epilepsy, is something that is really misunderstood. And actually, when we got to interact with NECC and understood exactly what epilepsy is all about, we realized that most of us have very little knowledge. Our interaction is very superficial. We don't actually realize that some symptoms that we see are things that are related to epilepsy, and they can be managed, and someone can continue having a normal life, as has been mentioned by the other speakers. So we are very proud to be partnering with NECC. We will be going, today we are in Uasin Gishu County, and we'll be traveling to other counties throughout the year, just creating awareness, letting people know, helping medics to also understand with NECC on what the symptoms are, how to manage the condition, how to help people, and to just demystify the issue of epilepsy. Bank of Africa, I will say a few things about the bank. We are we have 34 branches across the country, so we are a bank that is growing. We have been in Kenya for 10 years. We are a Pan-African bank, but like we say, we are Bank of Africa. Sisi ni bank ya mwananchi, bank yetu. So we, as Mrs. Musendi said, we recognize that we need to be with the society to give back, even as we do our business. Even as we do our business, we need to give back to the community. So that is the reason why we partner, and that is why we are here today in Uasin Gishu County. I just want to ask my colleagues to just stand up and wave. I'll introduce them.
Epileptic patients are considered to be people who are cursed bewitched, demon possessed, and all other bad descriptions which are not scientific. And I believe that coming to create awareness is going to help in changing of attitude amongst family members. It will enable other people learn more and also assist in developing a positive attitude towards the disease and making each one of us move forward so that we can be able to help those people who are suffering from epilepsy. It's sad to note that we have about 2% of the population are epileptics. If you consider 2% overall in a population of 40 million, it runs to hundreds of thousands of people. That's a very big number. And when you take it on a global scale, then those who are affected by the disease is more than the total population of Kenya. So you can imagine removing a population like Kenya, removing that number away and adding to Rwanda and Burundi, how disastrous the disease is. When you learn from percentages, the percentage will be negligible. But when you look at the absolute figure, it's dangerous. So I think, Professor, thank you so much, because I am sure at the end of this exercise, more Kenyans will be positive. One, to know that this disease cannot be passed by touch. This disease is not as a result of, hurting your ancestors, among other misconceptions. And I believe you can also help governments. You used to deal with one government, but now you have 47 other governments, which are not inferior to the one that you knew. Then you can help the emerging ones come up with the policies and the ways that we can be able to handle this. I think I will say for sure, we don't have fine figures in Wasingishu as to how many people we have, but I will say they are there. So once we learn that now, it will be easy to focus on those people. To remember that in our training programs, we need to have elder workers who are specialized in areas that deal with them. You know, we have been dealing on general areas, but now these are non-communicable areas that are unique, but little. We need also to train people, but more so to assist in changing of attitude that people have. That sometimes you may not greet somebody who is epileptic, and that one hurts him more or her more when you discriminate by feeling that the fellow is not a full person. So I am certain that with this exercise you will achieve, but more so assist us with some small notes on how we can legislate and move forward to improve the lives of those people. For the media, we want to appreciate your coming. Try to help also to sensitize the public so that there could be a change of attitude. Sometimes we normally think possibly if you can be able to interview them in your TV or in your radio stations, you can be able to make people learn that those are also ordinary people when they are seen through the media or when they are heard. You know, it makes people who have wrong misconceptions change their attitude. So I just want to say thank you so much. I think we are ready for the flag off, and we wish you